Martin Hyde?
I don't know what they're asking, but maybe.
Yeah.
Good afternoon, everyone. Again, I promise this is the last time today. Just get me out of the way early. My name is Martin Hyde. Before I say anything else, I've put a Rubik's Cube here for the Vice Mayor. She can use this when I'm talking, as when I watched video of the last meeting, she seemed to be running out of papers to shuffle and places to look other than at me. This will give her something to do when I'm addressing others who at least try to give the impression of listening. I wanted to touch on this item as it impacts not only the city budget and city taxpayers, but goes once again to the question of who runs the city. This item concerns a stop-loss policy for the city with Cigna Health. The premium is not insignificant, $728,000 taxpayer dollars a year. This is an increase of $64,000 taxpayer dollars on last year. The staff, quote unquote, recommends keeping the deductible at the same level, which is hardly a shock, seeing as staff isn't paying the increased premiums. Going to a higher deductible and passing some of the risk to staff would save city taxpayers a considerable sum. The notes to this budget item that in the last 5 years the city had 13 claims of over $250,000, resulting in $3.9 million coming back to the city. I haven't got any evidence to back that. It seems to be anecdotal. Maybe Stacey will bring it some supporting documentation. As frankly, to my mind, it's doubtful. Most insurance companies charge more in the long term than they pay out rather than less. What happens outside of the alternate universe that is City Hall is that organizations have to make difficult choices about health insurance. In my experience, people never value things that they don't pay for themselves, and healthcare is a good example. This is a 9.7% increase for taxpayers and no increase for the employees. There is no equity in such a lopsided distribution of obligation or consequence. There is no reason for anyone to ever order anything other than the very best of everything if somebody else with deep pockets is going to foot the bill. The questions here are, firstly, why is the healthcare not the subject of a major discussion of wants and affordability? Secondly, how many times are staff likely to not recommend something that benefits them directly? And the last question of who runs City Hall, i.e. the staff or the Commission, will be answered if you vote to approve this without questioning it carefully. Thank you.